Good morning. Thank you so much for being here, and thank you so much to the World Food Prize Foundation for making space for today's conversation. Older adults are often among the most likely to go unseen, right, when experiencing food insecurity. So we'll talk about that a little bit more today. So I appreciate you making the space for this conversation today. My name is Bambi Press. I serve as Healthy Aging Director for the Iowa Department of Health and Human Services, which means I get to work with Iowa's 6 area agencies on aging who provide about 2 million congregate and home-delivered meals each year to older Iowans 60 and over and their spouses and caregivers. So I'd like to stop for just a moment and have you raise your hand if you've ever delivered a home-delivered meal, commonly called Meals on Wheels, or if you've ever dined at a congregate nutrition site in Iowa. So I see quite a few hands going up. And this is one of the things that I really love about, being able to, go out and talk to people about these programs and services is, we often see that so many of us already have a connection to these programs and services. So they're authorized by the Older Americans Act, which actually celebrated its 60th anniversary on Monday of this week. So July 14th of 1965 was when the United States really kind of put this legislation in place that recognizes that older adults need a special system of services and supports to age in a healthy and independent way. And so the Older Americans Act was born, and a really key part of the Older Americans Act is the nutrition service program. So this program really kind of serves as a welcome mat to kind of really literally bring people to the table so that they can take advantage of the other services and supports that are offered by area agencies on aging and local service providers and community-based organizations across the nation to really support those efforts. So, Tim will talk a little bit more. He works with one of our area agencies on aging about what that really coordinated system looks like. Because we recognize that food insecurity doesn't live in a vacuum, right? To carry through some of the themes that I think we've been talking about this morning, really recognizing that while those meals are often the first home and community-based services that people receive, an area agency on aging can provide so much more in terms of helping people navigate those programs and services like Medicare and Medicaid, which, interestingly enough, were signed into law that same year in 1965. So I would like to take a moment to introduce our panelists. Deb Fenton-Roe, who is a United States Army veteran and mobile food pantry coordinator. So Deb, thank you so much for your service and for being here. And Tim Getty, who is our regional nutrition services coordinator for Heritage Area Agency on Aging. So I'll start with you, Deb. Could you tell us a little bit about your role and really what is unique about serving older adults and veterans?
I brought my cheat notes, so bear with me. And before I say anything, I would just like to recognize if there are any veterans in this room, please raise your hand. Thank you. Thank you for your service. There are 178,000 veterans in the state of Iowa, approximately. And I have to look back at my cheat notes because I don't do well with numbers. That came, that came out of the GDX report that is from 2023. Soon we'll have 2024 out and it'll be an updated number. The uniqueness of serving veterans, it can be a challenge. When we first started out, we were approached by the Food Bank of Iowa that said, hey, we'd like to do a veterans food bank distribution for Wapello County. We thought, okay, all right, sounds good, we'll do it. We started out the very first month, we served 60 veterans. We are now at over 200 veterans per month in that 2-hour drive-through. We have a complete drive-through building. And I have to look back at my numbers because it tells me from the time that we started of April of 2022 until May of 2025, we have moved and distributed 263,271 pounds of food. That supported veterans and the spouses of our deceased veterans. The challenge to that is veterans are unique. Veterans have been trained to do with what we have and make it work. Veterans will say, no, give it to someone else that needs it more than I do or deserves it more than I do. And trying to remind them that your service has not been forgotten and we are not going to put you to the side when you need something. How about that?
That's great. Thank you. Tim, how about you? Can you tell us a little bit about
Tim Getty, as Bambi so graciously said, I'm with the Heritage Area Agency on Aging, based in Cedar Rapids, Iowa. And I've been with Heritage as the nutrition coordinator for a little over 17 years. And I came from the corporate world, so that was kind of a culture shock for me. What we do is, again, nutrition, as Bambi referenced, is the largest program of an area agency on aging, but we're seen as the front door for additional services. They would come to a congregate meal or call one of our providers for a home delivered meal. Our region covers 7 counties in eastern Iowa, so we are the second largest metro area in the state, and we cover very remote, desolate areas to Cedar Rapids metro area, things of that nature. And as Deb was mentioning, we're seeing the same things working with older adults. You know, just give it to someone else, or that program is just for poor people. You need it more than I do. We subcontract almost all of our nutrition program services for production and things of that nature. And about, I would say a handful of times a quarter, I get a call from one of our subcontractors asking me to call a prospective client because they would say, you know, I don't need it. I don't need to give it to someone else, but even though this is the only lifeline that this person may need.
Yeah, that's great. Thank you. So, you know, I think as we talk generally about kind of what these programs do, you know, I'd love to kind of zero in a little bit more on who these programs are really serving. So, you know, the purposes of the Older Americans Act nutrition program are not only to address hunger and malnutrition and food insecurity, but also to help address social isolation that older adults often experience, and also to provide opportunities to participate in health promotion services. So those might be like falls prevention programs or chronic disease management programs. For that reason, we see something that's a little bit different about I'll call it the OAA, is that there are no income requirements in order to participate. And this is something that's often misunderstood about the program. So while area agencies on aging are charged with targeting services to those who are in greatest social need and greatest economic need, really anyone 60 and over is eligible. And these programs are voluntary contribution based. So kind of echoing through with some of those comments that we heard about some of that reluctance, especially among older adults and especially among older Iowans. I'm not a native Iowan, and so I've definitely, you know, learned more about that since I moved here. But you know, some of that reluctance to participate, right? Give it to someone who really needs it, even when that person is the someone who really needs it. And so, you know, I want to take just a moment to talk a little bit then about how we see programs and services for these individuals, you know, changing as you're navigating, you know, funding changes and changes in the needs and expectations of those people that you're serving. As we see those levels of food insecurity, even among older adults, rising in Iowa, we're a state where we typically actually see lower than, you know, state or lower than national average rates of food insecurity among older adults, but it's still close to 7%, right? Which is like 55,000 people and more who every day are having to make that decision, right? Between paying for food, paying for housing, paying for medication, all the other things. So curious to hear a little bit more about how you see your role changing as you're serving those populations, you know, today and going forward.
Go ahead.
Okay. So how our roles have changed, or my role specifically has changed, is it really started like everyone pretty much in this room that was that was in their positions during COVID. Our programs had to change on a dime. Our congregate programs were shut down, and we had to pivot to food distributions and things of that nature. I know some social service programs, they would come to me saying, well, you know, isn't that great that, how are you enjoying your time off with your program since you're not having a lot of business? And I said, actually, I'd rather the pandemic be over so I can take some time off. So, and it really changed, and what COVID did, and I know we talked about funding and innovative programming, but specific to older adults, they were so nervous about the pandemic, they delayed a lot of their medical care, so that really pushed it back. A lot of pre-existing conditions worsened during the times and things of that nature, and thus we saw an influx, not directly because of COVID-19, it was because of the delayed personal care. The other thing that we have noticed that we've had to change is perception. I know back when the Older Americans Act was started many years ago, it was the frail, the most needy, great-grandma, great-grandpa getting a home-delivered meal. That whole dynamic has changed. Older adults are living longer, they're working longer, they're raising grandchildren, so there's so many different demographics that are happening that has caused us to change how we provide services, especially with our congregate programs. Modernizing. I remember one time, it just was like an epiphany. I was at a conference about 10 years ago, and the keynote speaker was speaking, and they said, stand up if you've been doing everything, how long you've been doing the congregate meal program or the Older Americans Act nutrition program. We all stood up, was rah, rah, rah. And then they said, well, sit down if you've done everything, if you've started new programs. Most of us sat down, and there was about 25 people in the room still standing. And they said, for those of you still standing, if you don't change, your programs will cease to exist within 5 years. That is because needs are changing. We're looking from the meat and potatoes to the typical meat and potatoes, transitioning to your more salads. Palates are changing, what expectations are changing. And we've really had to transition our nutrition program to what we called in the business world perceived value. Even though, as Bambi mentioned, we're on a contribution basis, but there's also a value of their time, where some might not be able to contribute, some maybe can contribute $10 a meal. But we have to get them into the room or the congregate dining site, or also to receive that home-delivered meal, or agree to receive nutrition counseling with a dietitian, things of that nature. Deb?
Well, our roles have drastically changed. In the very beginning, as I said before, we were approached by the Food Bank of Iowa and asked if we would start this program in Wapello County. We only have 2 counties that is doing this specific to veterans, and that's Polk County and Wapello County. We won't turn away anyone just because they're not in Wapello County. That has grown, so we now have people coming from an hour away, driving to us to sit through the line to get the mobile distribution of whatever food it is. We have a wonderful source that has been paying for our part of the distribution, the food, Tumwa Regional Legacy Foundation, and they have supported us to the Iowa Food Bank since its conception, so since 2022, and we're very thankful for them. When we first started out, we were out in a mall, a closed mall, parking lot. So we were in the elements. So we had rain, we had some snow, we had some 95 degrees days, And then we were invited to go into the emergency management building, which was perfect because it's a drive-through building. Now, none of our veterans or spouses have to leave their vehicle. And the majority of them are elderly veterans. So they drive, we register them, they drive through, we have several stops for them, and then they can drive right on back out again. We have grown now, it's a co-coordinator and I, we have grown now to the point that we have a radio program once a month for an hour long, and we talk about our food bank distribution. We tell what is going to be given that day. And it comes on that morning. We do it that morning. What's going to be given that day? We talk about veterans issues. We talk about United States history, because there's always something every month going on with our history. We are so lucky that we, with a zero budget, we are so lucky that we have places that we can make flyers from, that they've donated. We have our radio time, and we have volunteers that come every single month. Most of the time we have more volunteers than what we actually need, but we're not going to ever turn anybody away. We'll find something for you to do, and it comes from their heart. And these are, few of them are veterans, but most of them are civilian volunteers. We have now grown to that point where we have people contacting us, asking us, can we donate along with your distribution? There's a meat packing plant in Ottumwa that, God bless them, last year they brought in an entire semi full of bacon and pork loin, and everybody got bacon and pork loin. We've had United Way contact us wanting to give away tomato plants. We've had Legal Aid has come to give their information out. It's just been a wonderful way to reach out to people that they had no idea that they were missing out on any of this stuff until it comes to them, until we can bring that to them. There's something else. The reason why I am so very proud of this, the growth that we have, is in Iowa, 47,000 veterans are disabled. That disability goes on different levels, but we also have to take care of and think of our veterans with PTSD that choose not to leave the house, or that day may not be a good day to leave the house. We have, and my husband and I are two of them, but every single volunteer that comes through to help us, we usually have 20 every month, they also are delivering to those homebound veterans or spouses, to the disabled ones that physically cannot get out to go do it. And what a blessing that's been, because we continue to reach out more and more. So our roles just keep evolving. When we first started out, like I said, we had 60 people that we served and a handful of veterans. And we thought, we're not sure, or a handful of volunteers, we're not sure if this is going to work or not, how we're going to do this. It's raining, and they stuck it out with us. So we continue to evolve every month, and I'm so happy about it. And people help us out. We don't even ask for it. People are now calling us and saying, can we do this for you?
Yeah, that's wonderful. And I really want to kind of echo a couple of things that you guys have talked about. So one being really the importance of those public-private partnerships, right, to make these programs work. And also, I think, this big shift that we're seeing in really just kind of how services are delivered, right? I mean, how we, literally bring people to the table, and sometimes that means meeting people where they are, right? And providing services in a way that's really centered on that person and their needs. Iowa's actually been recognized as an innovator of nutrition services across the state, so I want to invite Tim to talk a little bit more about this. But one of the ways that we're doing that is, if you've been to a congregate meal site, that's in one of those more traditional sites, like a community center or maybe a faith center. Those are wonderful, and they certainly serve a great purpose. We also see a lot of success with restaurant partnerships across the state. So when I talk about how these programs are really charged with targeting people who are at greatest need, as we start to dig into the data, we find that when services are offered in that way, that a way that really kind of preserves dignity and allows people to access services on their terms, especially when they're working longer, serving as caregivers, the opportunity to instead grab a meal at a restaurant on an evening or a weekend, or meet friends for breakfast, completely changes the equation, right? And so we find that those partnerships in a lot of cases have been dramatically more effective in reaching those targeted populations that these programs and services are intended to reach. And it can be hard to see, right? Because when you're serving the same 20 people who might come to a senior center every day, you know them pretty well, and have an idea of what people's lives at home might be like. In a more community-based, community-inclusive kind of environment, like a restaurant, it's certainly, not as obvious sometimes. So I want to invite both of you then to talk a little bit more about kind of that shift and some of the innovative programs that you've launched at Heritage, Tim.
Sure. So as Bambi mentioned about the Iowa being recognized as innovators, it's kind of like goes back to the Iowa roots, just picking ourselves up by the bootstraps and getting it done. I would say, oh my gosh, I can't believe we've had our programs over almost 8 years. But nine years ago, and Heritage, we can be kind of competitive. Hey, how can we do things better? How can we serve more people? Things of that nature. We did a study, and we found out we were only meeting 7% of the eligible older adults in the Cedar Rapids metro area, and also in our most rural areas, and that wasn't very good. Back about 9-10 years ago, Iowa was known as one of the top 10, just like David Letterman, one of the top 10 fastest declining congregate meal participation in the entire country. That's not a top 10 I ever want to be on. We did apply with at that time it was the Iowa Department on Aging, reached out to Heritage and said, because of your decline, what about if we collaborate together? Working with the state to innovate a new service and kind of reinvigorate the congregate meal programs. And it's like, okay, so we just did the what we really thought would work. So let's just throw something out there and see if it sticks. And long story short, my goodness, we received this federal nutrition innovation grant. So what is it? It is called the Encore Cafe. It is a pop-up cafe. At a library, in a faith center, in a park, in an arts and environment building, in a lodge, and then also at another faith center down in rural Washington County. And we developed that in a way not to replicate what has been done, but do it more of a flexibility as we're talking about needs are changing. Instead of we serve at 11:30, everyone is gone by noon. It is, we serve from 11:30 to 12:30. We contract with the Hy-Vees in our area, and they provide choice menus. I know with Bambi's leadership and the Iowa Department on Aging, they said, well, have you thought about trying it this way? What about doing it this way? And we said, well, what the heck, if we already got the funding, why don't we just do it all at once? That's why I don't have much hair left. So we tried to do it all, and by golly, it worked. Within 3 years of implementation, we went from one of the top 10 fastest declining congregate programs to one of the top 10 fastest growing congregate programs. And we were named by the Administration on Community Living one of the 3 most replicable programs in the entire nation. And that is not because of me, it's because of our team, our consumers, our volunteers. We actually were able to grow our staff and maintain our staff. It has grown so much. I'm more of the coordinator of the nutrition programs, where I oversee everything, and then we have 2 Encore Cafe coordinators. That's pretty much their focus in their positions. The volunteers, we went from, we use real plasticware and silverware, beverages instead of I said one of the reasons why I would close down one of our Encore sites is back in the 1970s when they had the big missile coffee pots. I said, I never want to see a missile coffee pot in one of the sites. And then I put it on each table. And then the volunteers come to me and go, we're spending too much money on coffee. And it's like, well, okay, number one, we have the funds, but no, let us pour it. I said, are you sure? So they're pouring beverages, and we're offering salad bars. And what I pretty much said was, I am so glad the program didn't end up like I proposed in the grant, because it's so much better. And it just, like we talked about collaborations, we got donations of billboards. We have mayors being our advocates, going door to door, finding volunteers, things of that nature. And then it just ballooned into, from COVID, as Bambi mentioned, the Iowa cafes. We call ours Encore Express. From 2 or 3 dining sites, we now have an umbrella program for Encore Express. And again, with vouchers, meals, flexibility, things of that nature, so that we really did meet the ever-changing need.
I can't follow that. Well, as I said before, what we do in Wapello County around that area, we're all volunteers. I'm also a Wapello County Veterans Affairs Commissioner. We are lucky enough in Wapello County, not all counties in the state of Iowa for their VA offices have this, but we have a donated funds account where people can actually just donate. And then we can use that for any of the veterans that come to us and they say, I am in dire need. And it might be, food for a month for the family. It might be housing. It could be anything. We've done several things with that. But the other thing that we have is we can do food vouchers from them, and it's paid by our county. They come in and they can fill out the application for the food voucher, and then as commissioners, we'll sign off on it. And they can go to either Hy-Vee or Fairway. We have, over the years we've learned, but we have a specific list of items that they can purchase, and it is sustainable food. So it's not, you can't just go and buy chips and pop and it's got to be some nutritious food. The other thing that we do too, after our food bank distribution night is over with, our VA office, we actually bought a small chest freezer. So any of the meat products, usually we have chicken. In the wintertime, we definitely have ground deer. Or venison. We have hamburger, different kinds of protein, frozen protein will come to us that month. So any of that leftover, we keep it in our freezer. We also have our dry boxes, and then if it's any type of vegetable or fruit that we think can last a little longer, we take it all into our Wapello County VA office. And then when someone comes in and says, I'm down and out, I got stuff for you. And we load them up with food. And that's what it's supposed to be for. That's what the program is meant for us, is that helping hand. And I'll tell you, 200 cars driving through in 2 hours, and every single one of them will say, thank you for what you're doing. And we just say, it's okay, we're vets helping vets. Because in that world, we're brothers and sisters, and that's how we honestly look at each other. We don't look up, we don't look down. We're brothers and sisters. I wish that I could find a way to do something a little more nutritious for them, for our older folks that are maybe just the 2 of them at home, maybe they're widowed. those meals that they're fixing themselves at home just really aren't that nutritious. They'll grab a sandwich and maybe some chips, and they'll be done with it. Or they might not eat at all because it's not always so fun to eat or cook just for yourself. I would love to see a program where we could make some frozen meals, because we know that the older people will go to the grocery store and buy those frozen meals and pop them in. My mom lived that way for a long time. Pop them in the microwave. But when we look at the nutrition value on it, it's full of sodium and it's full of fat. So what are they actually getting? They're just getting something warm in their tummy that tasted kind of good. I would love to see a program come up with fresh meals prepared and frozen, and that they could sell at an affordable price. Meals on Wheels, I think, is a great program, but they only get it once a day. No offense.
No offense taken, no problem.
Sure.
They only get it once a day. It'd be great if they had something in the freezer they could say, oh yeah, I'll just pop that in. So if anybody comes up with a great idea like that on how to do it, call me, I'll help.
Yeah, I think we all have to work within the capacity that we have, right, to provide those programs and services. So thank you both so much.
Thank you.
In closing, I think I would just like to say, if you are able to volunteer, even though Deb says she has too many volunteers,
Never
but I know
too
that's
many.
not the case. I know that's not the case everywhere. So if you're able to volunteer, and if you're eligible to participate in some of these programs and maybe even make a contribution, please consider doing so. Even if you encounter a wait list, go ahead and get on that wait list, because we really don't have any better way to demonstrate the need for these programs and services. So thank you so much, both of you, and thank you all.
Thank you.